I'm Dr. Pat Nolan. I'm a public health physician, retired. So I'm back out of retirement in some ways to talk to you today. The aspect of Medicare for all that I want to particularly address is how important your health is to me and how important my health is to you. Because so much of our discussion about the need for health care is around, well, that guy needs some health care. And this is not really how the world works. And I really appreciate the Bishop's comments on that. Every American should have access to essential health care. That doesn't mean everybody needs to get a nose job, but it does mean we need the kind of care that allows us to be good citizens, good family members, and protectors in our community. What protects your health protects my health, and vice versa. If you need healthcare services that you cannot pay for, it may raise the cost of my health care and my health insurance. So I have a personal, economic, and community interest in your health. If you require health services that you cannot pay for and you can't receive them and don't get the care you need, it can increase my health care risks. And we're all busy trying to protect our health in a difficult situation. We need to know how much it matters what each other is able to do for their own health. If you should have preventive health care services that you can't afford to pay for and don't receive the care, or if you turn down the essential care, you may increase my health risks. You may increase the risks of your children, of your grocer, of the people in your community with whom you do business. We're in this world together. And finally, if you cannot afford health care services, you may lose the ability to care for your family, to work, and otherwise work in your community. And you may need support for yourself and your family, becoming financially dependent on public support. We should have policy and healthcare direction that pushes off the risk of those needs, reduces it so that you can receive the health care you need. So if having healthy citizens is a public good and lacking access to health care services undermines our health, how can we distribute the costs of health care equitably? And how can we afford universal access to essential care? That's an important question that we clearly have major differences of opinion on. Our current methods of payment differ from state to state, town to town, people to people. They're different by income levels. They're different because of our health problems. They're different because of our citizenship categories, the sources of our care, our personal preferences, and our geographic locations. The result is duplication of costs, fragmentation of services, delays in care, and poor outcomes, to name a few. This is why I, as a retired public health person, am particularly interested in achieving outcomes that bring health care to all. There's a big question. Is a single payer system the answer for health care here in Rhode Island? And if so, What could it look like, and where would it start? We get lost in the details if we don't have an overview of those issues. So I would like to say, think about it as a question with no simple answers. Is it a state-based health plan? Rhode Island Medicare for all? We're a very small state. Most of us get our health care in one way or another from somewhere else. Is it a regional plan? New England, Massachusetts, Rhode Island, and Connecticut? We share a lot of health care amongst the New England states. So perhaps that's a way to think of Medicare for all. Is it a national plan, the continental United States, or U.S. and its territories? From my point of view, there are a lot of issues there. Having worked in states ranging politically and geographically from Arizona to Rhode Island, I can tell you that there's not a lot of shared ideas about what a health plan is. On the other hand, when I lived in Arizona, we adopted a fairly good community-wide health plan. So it can be done. Is a competitive choice of plans, such as we have now, still the best American model? If I can afford more, I don't have to pay for your help. I can just buy my own. We have a lot of discussion to have over what should be a model and how we can develop it. I think that's the important piece from my perspective for what we're trying to do here, is really think about how we can bring about health improvement and health care for all in the political, economic, and social world of the United States. That's a lot to think about. I'm looking forward to how this discussion goes. Thank you.